And also it's also about the patient awareness, because we lose the patient awareness about the sphincters, and also the patient awareness. You told me before we met in Egypt, you told me we have to also make a good counseling for the patients, good counseling about the complication, because also the patient has to know what's with a realistic how we call it, realistic expectations for both penile implants and the sphincters.
Yeah. Knowledge is power, and you know, particularly in the Middle East, which is so conservative, with men who don't want to speak about the fact that they get wet because they can't control their urination or they can't get an erection. So it's quite difficult to educate them, and so I'm glad to participate in a talk like this, which you will use to educate people that there's a very simple device that can be implanted through a little tiny 2-inch incision that will help them get control of urination. And boy, what a quality of life issue it is to be wet. It's depressing.
Exactly, especially that other complications that could happen with incontinence, like ulcers and like infections and stuff like that. You can reach up to 5 years with good control of your quality of life. Even also, we can put both, you taught us that today, we can put both the penile implant and the artificial urinary sphincter in the same set with the same incision.
Yes, we can. And it takes like an hour and a half, and through an incision that's only that big. And then they've got both of these terrible complications from pelvic surgery fixed.